Welcome to the Clearground Show. I'm your host, Dr. G, with a PhD. The COVID narrative tide is turning, guys, and we're here to catch it all. So first, we'll look at 3 stories from CNN discussing different facets of COVID. From there, we're going to move on to a brief overview of the Senate testimony from yesterday, Tuesday. We'll talk about the Pfizer CEO and a video that was censored from him and about him. Then we'll look at San Francisco, how COVID cases are doing there. We'll take a look at what the CDC director has to say on a couple of things on COVID. And then, of course, there's a group of people and a group of states and a group of governments that are not turning this new leaf, and they are sticking hard and fast to their old COVID rules. We'll look at a couple of Houston hospitals that are going to require COVID boosters for their employees. Connecticut is allowing nursing homes to take COVID positive patients again. Virginia has kids learning outside in 24-degree weather. The Ronald McDonald House in Canada is evicting anybody over the age of 5 that doesn't have a vaccine. We'll get into all of that and much more in today's episode. And don't forget, guys, I'll be doing a mailbag session this Friday, so comment any questions you might have about any subject in the comment section, and I'll get to a couple of them on Friday. So in the last week or two, CNN has had a real 180 in terms of COVID coverage. It's amazing what happens when everyone you know gets COVID, huh? Well, let's break down a couple of these clips and see what they have to say about it. So let's start with Brian Stelter talking about how maybe the media is out of touch with the regular people of the U.S.
In the Reliable Sources newsletter, here's a big, overly broad question for you, okay? Is the media at this point out of touch with the public about COVID?
I think it's hard to argue that, the media is a large group of people, but a lot of the media does seem, when I look at it and then travel the country, to be very out of touch with people. I mean, if you travel the country, people are not really living in the same bubble that it seems that most of the media is messaging toward.
Right.
And so, yeah, and so I think this is an issue, because if people are tuning out what's going on in cable news, if we're not messaging toward the general population, they're just ignoring everything and living their lives, and we're not really getting the information that they need.
So the short answer to Brian Stelter's question is yes. There's a reason why the main audience for CNN are airports. They've spent 2 years peddling very explicit COVID narratives, and not just COVID narratives, but other political narratives that have really not sat well with the American public. So this question is at the forefront of their minds, but it's already happened. People have really stopped listening to many mainstream media channels. Because we've been focusing so much on COVID policy here on this channel, let's take a look at 2 different videos on CNN about how they're looking at COVID and doctors now. First up, we've got Sanjay Gupta and Jake Tapper.
So the hospitals are still stretched thin because of this, so I'm not trying to take away from that. But if 40% in some hospitals, 40% of the people who have COVID don't necessarily have problematic COVID. They're there because they got in a car accident. They're there because,
right.
They bumped their head, and they're being included as in the hospital with COVID. That number seems kind of misleading.
Yeah, I agree, Jake. It surprises me that they have not been able to parse out that data more carefully. I think the data that Dr. Walensky is quoting is from New York State, and we've been following that data as well. And I can show you what we've seen, sort of tracks with what
I remember not so long ago, even as far as a couple of months ago, you would be canceled, totally canceled, for pointing out or just even asking who's dying with COVID and who's dying from COVID. So it's amazing to watch CNN turn a leaf all this week. So welcome to the program, guys. Thanks for tuning in. And for our last clip from CNN, let's see what this doctor has to say about other doctors and their behavior during COVID.
Let me just say this. I don't ascribe ill intent to these doctors. I think most physicians went into medicine to help people. I think a lot of physicians themselves are anxious and themselves are trying to offset their own anxiety by broadcasting to a wider public the anxiety that's in the air. But if doctors and public health officials don't check their own anxieties, their own fears, and take a moment to reflect on how they are messaging and how they are potentially doing harm by, again, sharing fear-based messaging, then we really, really should take a break. Because look, Doctors are people too. We're seeing a mental health crisis among healthcare providers as well. We are human. It's normal to feel anxious. It's normal to want to share our stress with others. But when it's affecting people's everyday behaviors and affecting the way they feel and their decisions, fear isn't motivating. Fear just makes people afraid.
Have these people ever seen a mirror? This is amazing. She's right now saying we can't be scaring people. Scaring people makes them do bad things or makes them do decisions that they might not otherwise do. They've spent 2 years inflating COVID numbers, running a COVID meter across the top, updating second by second the deaths and the cases, all to elicit certain behaviors. And only now are they saying, well, wait a minute, we need to slow down. Doctors are reasonable people. Doctors, you can't be giving into patient fears. You gotta look at this objectively. This has been a long time coming. And by the way, it's too late. It's too late for many. The fear is already set in. This mindset's going to take a very long time, I think, to curb itself and get back to something like it used to be. And CNN is one of the main contributors to this problem. So, thanks for joining the team now, guys. But after 2 years, the damage has been pretty much done. The only upside to all of this is that now there's at least a chance that we don't get banned for quoting people. So that's always nice. So yesterday on the 11th, the Senate committee heard testimony from Dr. Fauci, Dr. Walensky, and a couple of other doctors in charge of COVID, or in charge of the COVID response. And, I watched all 4 hours on C-SPAN. I wasn't going to talk about it, but I'll just boil it down to this. Basically, it was extremely partisan and nothing really productive came out of it. And I guess on one hand, you might expect that. But on the other hand, it's high time somebody gets held responsible for what's been going on. And I think that these doctors owe it to the public, owe direct explanations. I thought a few of the senators had some good questions. Surprisingly, I thought Mitt Romney had a good question, especially about more direction and more specificity about when to test. I thought that was great. I also really liked the heated battles between Dr. Fauci and Rand Paul, who is also a medical doctor. I think those are great because at that level, you have two people with the same degrees, and one of them is really hammering the other, and the other is not really answering the questions. So that's always nice to see. But for the most part, yeah, it was totally partisan. Half the group was defending every action that these doctors did, and the other half was pretty much targeting Dr. Fauci or Dr. Walensky on one point or the other. So in the end, nothing came from it, and you guys didn't miss much. Now, something big that did happen over the course of Monday and Tuesday was that the Pfizer CEO dropped a video. Well, he was in an interview, and he dropped a video that basically said 2 doses of the Pfizer vaccine offers, quote, limited protection, if any, against Omicron. That dropped January 10th. By January 11th, so yesterday, Tuesday, I was looking for that video because I bookmarked it, and Pfizer actually made a copyright claim and to remove the CEO's video comments, right? So they pulled it from Twitter so no one could get videos. But within hours of this video dropping, it was censored so people could not watch it. That should scare everybody. Let's take a look at the video right now.
And we know that the 2 doses of the vaccine offer very limited protection, if any. The 3 doses with a booster, they offer reasonable protection against hospitalization and deaths. Against deaths, I think very good. And less protection against infection. Now, we are working on a new version of our vaccine, the 1.1, let me put it that way, that will cover Omicron as well. And of course, we are waiting to have the final results. The vaccine will be ready in March.
So pretty immediately, you guys can see why this got censored, right? What he's saying is that 2 doses of the vaccine do next to nothing. Okay, nothing for Omicron. A 3rd dose offers, quote, reasonable protection. But then he says we're gonna have to make a new vaccine of the 1.1, and we're gonna do some tests on it now to make sure it's safe. But even though we're testing it now, I can tell you it's gonna be ready by March. So you can look forward to that. Another boost. This is perfect. This is perfect, by the way. Everyone's gonna get Omicron. Literally everyone is getting Omicron, probably in the next month or two, and we've already discussed it. For the for the vast majority of people, you guys are going to get a cold, and then you're going to be fine. If you're immunocompromised or you have a lot of comorbidities, the story might be a little different. You might have a much rougher go of it, but that's just how it's going to be. So these guys are releasing a vaccine or an update to a vaccine after everyone's had it. And I guarantee you at that point, they're going to show efficacy being 100% or next to it. Why? Well, they're going to say that for their purposes to sell the vaccine. But in reality, I think everyone's going to have been exposed. So your immunity is, it's conflating two variables there. Another reason why someone might want to take that video down is because that video is basically an admission that all these mandates that the Supreme Court was just hearing oral arguments for are totally bunk, right? Because if 2 doses of the current vaccine do nothing and a 3rd dose does maybe something, well, what's the point for mandating it? Ostensibly the point was to mitigate the spread, but we already know that the vaccines don't mitigate spread. But now we know that the current vaccines do next to nothing for the current virus. So what justification is the Supreme Court going to have to do any of this stuff? My guess is very little. And so that's another reason, why someone might want this video to be pulled down ASAP. But like we've been saying pretty much last week and the beginning of this week, the narrative is unwinding, and it's unwinding real quick. Let's check out an article from San Francisco Gate. The title of the article is, "The head of COVID response for UCSF's ER department says, I have not intubated a single COVID patient during the Omicron surge." The article starts off by saying, on Saturday, in response to hospitals begging for relief from a massive staffing crisis, the California Department of Public Health announced that most hospitals and skilled nursing facilities can bring COVID positive and exposed staff back to work without testing or quarantines. The staffers must be asymptomatic, are required to wear N95 masks, and are encouraged to work with patients who are already COVID positive as much as possible. Wow. So from firing unvaccinated people who don't have COVID to hiring and actually wanting to use people that are vaccinated with COVID, knowing full well that they can transmit COVID. I mean, ostensibly, that's why they're putting them with COVID positive patients as much as possible. But it's just amazing how fast that narrative changed. Just in November, they were shaming and firing nurses left and right that were unvaccinated, didn't want to get vaccinated, but were otherwise healthy. This is just unreal. But okay, moving on. So this news might come as a surprise to people who have been reading dire warnings about Omicron and some public health officials pleased to cancel plans and stay home. Many public health officials have argued these measures are necessary to prevent hospitals from being overwhelmed with COVID patients. Indeed, for the past few weeks, San Francisco hospitals have been in dire straits, but it's not because people are sick, it's because of staffing shortages driven by overly strict state quarantine rules, the director of COVID response at UCSF's emergency department said. After reviewing charts of every COVID-positive patient at UCSF hospitals on January 4th, Dr. Gene Noble, an associate professor of emergency medicine at USCF, determined that 70% of them were in the hospital for other reasons. Quote, "The real COVID crisis that our hospitals are facing is a severe staffing shortage that is compromising the quality of our care," Noble said Friday, shortly before the policy change was announced. Staffing shortages are so severe that California is considering canceling elective surgeries, as happened during the worst of last year's peak. Noble further stated that when she reviewed the charts on January 4th at 4 UCSF campuses, she identified 44 hospitalized patients, both adults and children, with COVID. Of those, just 13 were admitted because of COVID. "I do not expect that number to increase substantially or become unmanageable in the coming weeks," she wrote. "The death rate in California is actually falling, and the predicted peak of cases is only about a week away. The remaining 31, or 70% of patients that tested positive after being admitted for unrelated reasons, including a hip fracture and a bowel obstruction. They're all completely asymptomatic or minimally symptomatic," she said. I'll wrap up with this statement from the article. "So the emergency departments are flooded with the worried well that are simply seeking testing and reassurance." She added, "I have not intubated a single COVID patient during this Omicron surge. We have a total of 5 patients with COVID on ventilators across 4 hospitals. An average of 1.25 intubated COVID patients per hospital is a good news story." I agree, and these are facts on the ground in California. Even the CDC director in recent days is coming out and saying totally different things that I have not heard her say all year in her tenure as CDC director that fall in line with what we've been saying for months now and what I've been saying since the beginning of COVID. Let's take a look at this tweet. This came out January 9th. "We must protect people with comorbidities from severe COVID-19. I went into medicine, HIV specifically, and public health to protect our most at risk. The CDC is taking steps to protect those at highest risk, including those with chronic health conditions, disabilities, and older adults." Oh, you mean the people that we should have been protecting this entire time? This data was known for so long who COVID was really impacting. It's amazing to me that this is the first time I hear Dr. Walensky speaking this candidly about the subject. So after the interview that we played for you guys on Monday with Brett Baer and Dr. Walensky, where she told him, I'll get those numbers to you on who's died from and who's died with COVID, she went on an interview with Good Morning America where she had this to say.
The overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really these are people who were unwell to begin with.
I'm pulling up right now the study she's referring to, and it was completed by the CDC, and it's in their Morbidity and Mortality Weekly Report, and it came out January 7th of 2022. And basically what they showed is that among about 1.2 million people who completed primary vaccination during December 2020 and October 2021, severe COVID-19 associated outcomes were very small, were very low. And in that group, they found that 78% of the people who died, and that was, I think, it was like maybe 36 people, 78% of those had at least 4 comorbidities. This is, good news for that. Now do it with the population at large. I guarantee you the results are going to be very similar. So while some leaders in our population are turning a new leaf really, really fast, others are sticking to the tried and true original COVID stance. Let's take a look at some of those stories. So first, from the Houston Chronicle, Houston hospitals mandating COVID boosters for employees amid Omicron surge. This was on January 10th, 2022. 3 major Houston hospitals will require employees to receive booster shots in the coming weeks, becoming some of the first institutions nationwide to elevate vaccination requirements amid widespread worker shortages caused by the Omicron surge. Houston Methodist, Texas Children's Hospital, and Baylor College of Medicine announced booster mandates to little fanfare Friday, a marked change from last year's contentious debate over the legality and efficacy of such policies in healthcare settings. The updated policy comes 7 months after the sprawling health system mandated vaccines for its 26,000 employees, setting off a high-profile battle in which some workers staged protests and filed a lawsuit against the hospital, claiming the policy violated their rights. The lawsuit was dismissed in June. The same month, more than 150 Houston Methodist workers resigned or were fired for refusing vaccination. Old habits, or I guess relatively new habits, die really hard. In more Houston news, Judge Hidalgo returns Harris County to its highest COVID-19 threat level. But the Houston Chronicle notes, is anyone listening? And I'd like to hope that Houston Chronicle is listening to this show, because I was saying that exact same thing. And I don't think anyone's listening. I don't think anyone's going to care that Hidalgo raises it to whatever threat level she wants. They've been crying wolf too many times, and people are just tired of it. This story was astonishingly stupid to me. This comes from The Hill. Connecticut asked nursing homes to accept hospital transfers with COVID-19. So Connecticut is asking nursing homes to accept COVID-19 positive patients discharged from hospitals as the state looks to alleviate the burden on healthcare system during the latest wave of the pandemic. New guidance from the Connecticut Department of Public Health says post-acute care facilities, a category which includes nursing homes, should take in patients discharged from a hospital, regardless of COVID-19 status, and that's according to a memo dated January 6th. This comes as more than 80% of nursing homes in Connecticut are reporting positive cases of COVID-19 among residents or staff, according to the Connecticut Mirror. And while Connecticut has fully vaccinated more than 92% of residents aged 65 to 74, and 86.9% of those 75 or older, according to data from the state health department, early studies have shown that the mutated Omicron variant evades the immunity granted by vaccines more than past strains of the virus. Have these people literally learned nothing? Can they just not look back at what happened in New York? This is absolutely insane. The only saving grace for the people in these populations that are about to get slammed by this is that Omicron tends to stay in the upper airways and cause less severe disease, and that is really lucky for these people. But wow, incredibly, incredibly dumb in my opinion. Here's a video from Virginia where they're teaching kids outside in literally 24-degree weather.
She is reading a story to all these kids sitting outside in hats and coats and gloves. It is 24 degrees outside. 24 degrees. This is absolutely unacceptable. Unacceptable.
Completely unacceptable. That is a fireable offense in my opinion on the spot. More silly rules starting on Saturday, the 15th of January in DC. You're going to need to prove your vaccination if you're 12 years or older. You're going to need to prove vaccination and photo ID if you're 18 years or older. And you're going to have a mask. And that's for dining and drinking and doing a bunch of other things indoors. So that's good. Finally, here's a terrifying story from up north in Canada. This Ronald McDonald House in Canada plans to evict anyone above the age of 5 with no COVID vaccine by January 17th.
This is a piece of paper. Can Lindsay zoom in on it? This is an eviction notice, I believe, to anybody older than 5 who's not vaccinated is getting evicted from Ronald McDonald House. So I'm just gonna go talk to the people at the counter and see if it's legit or not. Like, we got this last night.
Yes.
It's just pretty disturbing. I'm just wondering if it's legit. Is this saying that like everybody who's not vaccinated is getting evicted?
Well, we have a grace period to which you can get your first dose, but essentially as of January 17th, it's a board mandate from our board.
So I just want to get this straight. So by the end of the month, my 4-year-old boy with leukemia is getting evicted because we don't have a vaccine.
The parents.
This is if he was 6 months older, he would be getting evicted. But yeah, because we don't have the vaccine, you're going to throw us on the snow with a few weeks' notice. Like, this is some kind of crazy evil like I have never seen in my life. It doesn't matter.
So that was the truncated version of the video. The whole video is in the link if you guys want to go watch it. Extremely disturbing behavior in Canada. The entire time she's talking to him, she totally doesn't even make eye contact or look down at the 4-year-old. It's just so cold, so heartless. It's hard to find words for how bad this is. And with that, we're going to wrap our show up for today. A few stories I didn't get to that we're going to touch on Friday are some vaccines and menstrual irregularities. This has been discussed since summer of last year and will show that it was thrown off as a nothing burger when in reality, there's a lot of science behind it, and we should discuss it and look into it and what the implications are. We'll talk about Djokovic in Australia because I think that is a huge success story, and we need to really emphasize that. We're going to also talk about this Veritas lab leak, and I think that's a big story because Veritas has a very good track record in terms of being correct about what they report. And we'll look at this lab leak theory they're reporting, and I think it's pretty crazy. So we'll do all that and much, much more on Friday. The tide is turning really, really fast, guys. And if you're on the side of reasonable debate and discussion and actually looking at the numbers, we're about to take this huge lead and I think eventually stomp out this total COVID tyranny. So if you're a doctor at Houston Methodist or one of these other places, don't be afraid to ask for the evidence. Don't be afraid to put up debate, and say, hey, if the booster, they're coming out with a new booster in March, okay, why are we taking a third dose of a vaccine that was designed for a virus many mutations ago, but 2 years ago? It doesn't make that much sense. Fight it. They're on their heels. A lot of these policies are going to go by the wayside, I think, in the next few months. So stand up, stand strong. We've got this. So thank you guys so much for listening. I really enjoyed our talk today. Don't forget, I have an Instagram, and check those out for the thumbnails. Also, again, I'll be answering a couple of questions in the mailbag Friday. So if you have them, post them right in the comments. Please enjoy this video. I think this prank is really funny, and have a great day. I will see you guys again on Friday.
Jason! Wait for him to pull out first. And then run out. Oh, there he is.